Good day, people. We're continuing our look at patient positioning. At the moment, what we're going to do is take a slightly deeper look at the supine position, and we'll continue on with this with all other positions, so prone, lateral recurrent, aka sideline, as well as seated. Okay, well, we're going to start with supine here. So when we're in the supine position, we look back to the previous series and we understand that the table makes stable. So in supine and prone, the patient is quite stable because a large amount of their surface area is in contact with the table. So movement is stopped by the table, which makes them safer. Now in supine, we're going to have a very hard time moving towards the table. So we're going to have a very hard time in the sagittal plane moving into extension, or backward bending. Okay? What we're going to have an easy time doing, generally speaking, especially with the limbs, is moving into flexion. Okay? So things going towards the front of the body, or forward bending. You can't see my leg at the moment, I don't need to pick it up that high, but I could pick my leg and pull my thigh or my entire leg towards my body. So engaging the sagittal plane in forward bending, or coming towards the front. Now that is easy enough, so the legs you can get good flexion out of. The arm, aside from going into extension, you can get quite free movement out of, so you can treat the shoulder quite well in supine. You can treat the scapula pretty well in supine. One of the challenges being is that it is essentially stuck to the table, so you actually have to reach under the patient, so you can't visualize it. So we look at the fourth concept there, and we understand that we want the anatomy exposed, free to move, and preferably visible. So in this case, we can work on the scapula, we can work on the shoulder girdle, but it isn't visible and it isn't as free to move, but we can make it move pretty freely if done appropriately. We can work on the neck quite safely and quite freely in supine in all planes, so we can work on the sagittal plane, we can work into flexion. It is suggested to avoid working into extension, especially if you're going to deviate from the sagittal plane, because you can challenge the vertebral arteries, so always be careful with that. You can create, under certain circumstances, flexion of the thoracic and lumbar regions, but it's quite heavy lifting for the practitioner. So it can be done, but it's heavy lifting. It's also quite available for you as a practitioner to work short lever on the soft tissues of the anterior surface, and should you need to, long lever on the posterior tissue, so you can use the arms or legs, or even the head and neck as leverage to essentially elongate the soft tissues of the back. So what we're going to do here is we're going to move into a patient demonstration after that general overview, and we'll go through a bunch of those steps again, a bunch of those descriptions again, when we actually see our patient demonstration. So here we are looking at supine position in a little bit more depth. We remember our patient positioning concepts, and the first one being that the table makes stable. So we understand when the patient is in supine, they have a large surface area in contact with the table, which means that they are more stable. So I don't have to go ahead and behave in such a way that I have to control the patient more. This position creates a lot of safety and a lot of control for the patient. Now, as we did in the intro, we're talking about the planes of motion. So with respect to the sagittal plane, the lower limb, we can easily work in flexion, so aka bringing the thigh closer to the torso. So we can do something like a straight leg raise, regardless of how this individual's leg moves, doesn't matter, but we understand this is easy. Creating flexion, moving towards the front of the body. Creating extension, no matter how hard I push, his leg won't go through the table. I have the opportunity to drop the leg off the table, but what that does, depending on the width of the person and width of the table, it engages the coronal plane as well, no matter what, with respect to the hips. So it's hard on the adductors, it can be hard on the knees. So it's not impossible to create extension with the leg, but it is difficult and it's challenging for the patient. I can create flexion within the lumbar column, but for me as a practitioner, it requires a bunch of lifting. So bend both of your knees, bring them towards your chest. Okay. So regardless of how I create this hold, I can create lumbar flexion, but I can't create it freely. It's very difficult, it's hard lifting. Let your legs down. So again, I can engage flexion in the lumbar column, but it's difficult. So again, I can move things away from the table. I have a hard time moving them through the table, so I can engage flexion in the sagittal plane. Extension is more difficult. Not impossible, but more difficult. The arm, I can move quite freely. In the sagittal plane, again, I run into the table when trying to create extension of the shoulder. I'll just come around here, or actually I can do this, just generally. It's hard for his arm to go past it. It's going to be hard on the shoulder. I can control it, but it's difficult. So we've talked generally about the sagittal plane. We'll talk about the coronal plane. So the leg, I can easily move in the coronal plane without much issue. Many ways to do it. The lumbar column, I can move in the coronal plane, whatever amount of coronal movement is actually available. I'm capable of doing it, but again, it's heavier lifting. So I would have to do something such as using both legs. Not impossible, but heavier lifting. And also, because the table makes stable, the fact that the patient is in supine on their back, it creates drag from the table. So their actual torso is quite stable on the table. I have more trouble moving it around. The thorax, I can move in the coronal plane, but again, it's more difficult because there's drag, right? So I can do something such as this. I can go ahead, I can slide my patient in the coronal plane. Some people call this the banana, they call it the smile, whatever you want to call it. You can do it, but there is greater difficulty. Just for the purposes of this video, I'm not in the perfect position to show everything. We'll do more specific things within regions as we go along. So again, just to be clear, sagittal plane flexion is relatively easy with the leg. With the arm, I can move in almost every plane, but the table does restrict extension. Within the sagittal plane, I have a hard time with the leg going into extension. I can work the leg in the coronal plane without much issue. The lumbar column is a little bit harder because I have to use long leverage to do it. I can use short leverage. I can push on the pelvis, right? So I can do something like this. I can push on the pelvis and create motion in the coronal plane, but it doesn't work as well as I'd like it to. Moving in the sagittal plane and the thorax is quite a bit of heavy lifting because I have to get the patient to grip and I have to lift them up. So depending on the type of practitioner that I am or the size that I am, the size that my patient is, again, quite heavy lifting. Some people very much like a method like that. Within osteopathic practice, it's called dorsal osteopathic gapping. Within other practices, it's called different things, but basically you curl the patient up into a ball and you can move them back towards the table. Not impossible to do, but heavy lifting. We want to consider the practitioner in everything that we do. So the longevity of the practitioner. The less heavy lifting you have to do, the better able you are to do these things over time. So just as an overly repetitive recap, sagittal plane, flexion is easy in supine. Coronal plane with the lower limb, no problem. Coronal plane and sagittal plane in the lumbar column, somewhat difficult, not impossible, somewhat difficult. Sagittal plane in the thorax is difficult. The arm I can move quite freely. The neck is quite easy to treat here because you can utilize the table and the pillow to keep the neck safe. So as we go along, we'll continue to look at those things within other videos. The other thing that's quite easy is to work on the soft tissue of the anterior surface of the body because it's exposed, free to move, and I can see it, right? So I can work on the soft tissue on the front of the body. Similar as in prone, I can work short lever on the soft tissues of the posterior surface of the body.